During this educational webinar, we'll be going over how Medicare works, what your coverage options are, and how to best avoid penalties and minimize expenses as you first transition to Medicare or as you review your coverage year after year. So first, I'd love for our panelists to introduce themselves and talk about the unique perspective they will bring to this discussion today. Ryan, would you kick us off?
My pleasure, Harold. Thank you. Hi, everyone. I'm Ryan Little. I work with Harold and Julianne on the Fidelity Medicare Services team as the Director of Business Development. I've personally been in the insurance field for over 15 years, and I've specialized strictly in Medicare for over 10 years. I actually joined Fidelity back in 2019 as we first launched this service to help guide people through what can seem like a very overwhelming milestone as they transition to Medicare. So really glad to be with you all today. Over to you, Julianne.
Thanks, Ryan. Hello, everyone. My name is Julianne Hansen, and I have a very unique role here at Fidelity. From September through December, I'm a licensed insurance agent and team leader here at Fidelity Medicare Services. And then the rest of the year, I get to help Ryan and the business development team spread the word about what we have to offer. I'm excited to shed some light on the ins and outs of Medicare with all of you today.
Well, thank you both. This is a very important topic, and there's a lot to cover, so let's dive in. We know that your estimated healthcare costs in retirement are much more than just a line item to review with your financial advisor. Because Medicare is the primary health coverage for retirees, managing your coverage is a major component of your financial future, and Fidelity wants to help. To help you craft an ongoing Medicare strategy, Fidelity has developed a new offering called Fidelity Medicare Services. We're committed to ensuring that you make a confident transition to Medicare and find coverage that meets your health and wealth needs. We have contracted with reputable health insurance carriers all across the country, and we can help you select and enroll into coverage that meets your specific enrollment timing, as well as your individual needs and preferences. Our team can also help you review and revisit your coverage year after year as your circumstances and needs change. Our Fidelity licensed insurance agents are paid salary. They are not compensated by commissions for selling insurance plans. And since launching our service back in 2019, we've met with tens of thousands of clients, walking them through the basics of Medicare, answering their personal complex questions, and for some, we've even assisted them in enrolling in a plan. Now, we're lending the experience we've gleaned from the thousands of client conversations we've conducted and boiled it down to really these three most important questions. First, and perhaps the most fundamental question, what is Medicare? In this section, we'll cover the fundamentals of original Medicare Parts A and B. Secondly, do I need additional coverage beyond original Medicare? In that section, we'll talk about extra forms of coverage you can purchase that complement Parts A and B so you don't face gaps in coverage. And lastly, how do I avoid mistakes and minimize costs? In this section, we'll go into detail on enrollment windows and how to manage your expenses as you transition to Medicare. So let's start at the most basic level. Most of us know that Medicare is a federal health insurance program created for individuals age 65 and older, as well as for individuals regardless of age who have certain medical conditions or disabilities. But Julianne, can you start by sharing some basics of Medicare with our viewers?
Of course. First, you may be curious about how Medicare is different from the coverage that you have today. Let's take the example of employer group coverage and highlight some of the key differences. The word individual is important when it comes to Medicare. Unlike employer coverage, Medicare is coverage just for you, not for you and your family. While you're likely used to an employer curating a short list of plans and guiding you through the enrollment process, Medicare is more self-directed. On average, individuals have more than 40 available Medicare options, which, unlike employer health plans, vary from state to state or even county to county. Additionally, Medicare is not just Medicare because it's made up of multiple parts. You may have heard of Part A or Part B already. There are also additional forms of coverage that can play an important role in ensuring that your needs are fully met. We'll cover all these different parts a little later on in our conversation today. Let's dig into Original Medicare, Parts A and B. Both of these parts are administered by the Social Security Administration. Part A is hospital insurance. It helps cover costs related to inpatient hospital care, skilled nursing facilities, hospice care, and in certain situations, home health care. Part B is medical insurance. It helps cover outpatient services and your doctor visits, like going to see your primary care physician.
Thanks, Julianne. That's terrific info and a great foundational start. So next, I'd like to help shed a little light on the costs of Medicare. It's a common misconception that if you've paid into Medicare taxes during your working years, Medicare will be available to you for free of charge. However, it's worth explicitly saying Medicare is a lot of things, but unfortunately, free is not one of them. Medicare has always been a cost-sharing program. So how much does Medicare really cost? Ryan, can you help shed some light on that very important question for us?
Absolutely. And Harold, you're exactly right. Medicare is not a free program and costs can really vary from person to person. Part A and Part B each have a monthly premium, plus each has its own deductibles, coinsurance, or copays. Most people don't have to pay for the Part A premium thanks to those Medicare taxes they paid during their employment. So if you or your spouse have worked at least 10 years and paid into Social Security taxes, congratulations, your Part A is premium free. Almost everyone, however, does pay the Part B premium. That amount changes annually and it could vary based on your income. More on that in just a moment. And Part A and Part B monthly premiums can be automatically deducted from Social Security retirement benefits. However, if you choose to delay your Social Security benefits, you will be billed for your premiums on a quarterly basis and pay Medicare directly. So next, I mentioned that your Part B premiums can change annually and can vary based on your income. So let's take a closer look at what that could mean for you this year. In 2024, the Part B premium starts at $174.70 per month, but can be well over $500 per month in certain instances. It's important to note that some individuals will pay a surcharge on the standard Part B premium because of the income-related monthly adjustment amount, otherwise known as IRMA. As you can see from this chart, the amount you pay varies according to your income, or more specifically, your modified adjusted gross income, or MAGI, from 2 years ago. It's also important to note that over the next few years, it's possible that your income will fluctuate. So in the future, if you experience a decrease in your income that would place you into a lower IRMA tier, there is a form you can file with Social Security to have your Part B premiums adjusted if your drop in income was in direct result of a qualifying life-changing event. Some common examples of a recognized life-changing event could be marriage, divorce, or even work stoppage like retirement. Next up, so in addition to monthly premiums, there are other costs you need to consider under Medicare. Generally speaking, Original Medicare covers only about 80% of your hospital and medical costs, and you are responsible for that other 20%. Additionally, Original Medicare does have some big gaps. So what about prescription medications or routine vision or dental coverage? Original Medicare does not cover these things at all. And that is why most people will choose to add additional coverage onto Parts A and B.
Well, that makes sense. So Julianne, this brings us to our next question that I'm sure is on the minds of many after hearing that, and that is, do I need additional coverage?
Harold, the short answer to that question is that you'll likely want to add additional coverage. While original Medicare provides some coverage for hospital and medical services, it doesn't cover everything at 100%. You can expect it to pay for only 80% of covered healthcare costs. Let's think through what 20% might look like in a couple different scenarios. Paying 20% of a doctor's visit out of pocket might be a $25 copayment. That's probably manageable. But paying for 20% of a major surgery, that could be several thousands of dollars, which might be much less manageable. That is why the vast majority of our clients choose to move beyond original Medicare and select additional coverage to help with these expenses. This additional coverage comes in two flavors: Medicare Supplement plans along with Part D prescription drug coverage, or a Part C plan, also known as Medicare Advantage. Today, we'll explore both of those options, but first, let's take a look at Medicare Supplement and Part D. Medicare Supplement, also known as Medigap, along with Part D prescription drug plans, complement original Medicare. In other words, you need to have original Medicare in place as your primary coverage, and then you can add either or both of these plans as secondary coverage. Medicare Supplement plans are made available through private health insurance companies, although they are still regulated by state governments. These plans charge a monthly premium and help pay your share of hospital and medical costs not covered under original Medicare. Premiums for these plans may be determined by things such as your age and location. After you pay your monthly premium, you could pay very little or perhaps nothing in the form of deductibles, coinsurance, or copays, depending on which Medicare Supplement plan you select. Under these plans, you'll be able to see any doctor or provider that accepts Medicare, and you won't have to worry about staying within a network. It's important to note, however, these plans do not cover prescription drugs. That's where Part D prescription drug plans come in. Part D plans are standalone plans that help pay for medications you buy from a retail pharmacy or through a mail order pharmacy service. Part D plans have their own monthly premium, plus copays, coinsurance, and sometimes a yearly deductible. Like Part B, Part D premiums are subject to IRMA surcharges that can vary based on income. I'll pause here a moment while we look at this and to highlight some of the key characteristics that we just discussed. Medicare Supplement and Part D help limit your out-of-pocket costs for hospital and medical care. It allows you to go to any doctor or hospital that accepts Medicare, so you're not restricted to a network. They will have separate monthly premiums for each, in addition to your Part A and or Part B premiums. And finally, they do not include extra benefits, dental, vision, or hearing. These must be purchased separately. Now that we've discussed how Medicare Supplement plans and Part D prescription drug plans could be one way to help reduce the out-of-pocket costs associated with original Medicare Parts A and B, let's dive into another option, Part C, also known as Medicare Advantage. Medicare Advantage plans are offered by private health insurance companies who contract with the government to provide Medicare coverage. They are sometimes referred to as all-in-one type plans. They combine original Medicare services with additional coverage, such as prescription drug benefits and sometimes other ancillary benefits like vision, dental, and hearing. While Medicare Advantage would become your primary insurance, you would still need to enroll into original Medicare Parts A and B before you enroll in a Medicare Advantage plan. In some respects, Medicare Advantage may be similar to the coverage you have today. There are HMOs, PPOs, and other plans to choose from. And if you're willing to stay within a provider network, it might be an easy way to reduce your costs. Medicare Advantage costs and coverage can differ from plan to plan. Plans have a monthly premium, although some are as low as $0. These plans also have deductibles, copays, and annual out-of-pocket maximums. To highlight some of the key characteristics we just reviewed, Medicare Advantage plans require premiums, but some can be as low as $0 monthly. They include an annual maximum out-of-pocket limit for hospital and medical costs. Medicare Advantage plans may have network restrictions for seeing doctors or going to the hospital. And they often include prescription drug coverage and extra benefits such as vision, dental, and hearing.
Wow, thanks, Julianne. I mean, that is a lot of very helpful information. So right now, many of you may be asking yourself, which of these options is right for me? Well, based on what Julianne just went over with us, here are some general guidelines to consider. Part C, Medicare Advantage plans, they may be good for those people who want a lower monthly premium and are comfortable paying co-pays and co-insurance for healthcare services. They might be good for those who are comfortable seeking care within a defined provider network, as well as for those who want prescription drug coverage and extra benefits like dental, vision, and hearing, all inclusive. Or there's the other option, the Medicare Supplement plan combined with a Part D drug plan. And those may be good for people who are comfortable paying a higher monthly premium in order to limit out-of-pocket spending on healthcare, and those who might also want the freedom to access any doctors and hospitals throughout the US, and also are willing to buy those extra benefits separately. It's important to note, however, that Medicare isn't your only insurance coverage option at age 65. You may want to explore coverage from a few other possibilities: a current or former employer, a spouse's employer, the state or federal government, or the VA. These can all be great options depending upon your personal situation. If you do take advantage of one of these other options, it's important that you make sure the coverage you select meets the definition of credible coverage, meaning that the coverage offered is expected to pay, on average, as much as Medicare would. If you don't, Medicare could penalize you down the line in the form of late enrollment penalties for Part B and/or Part D. Now, I'm sure you've heard that there are a lot of rules and timelines and possible penalties that you should be aware of when transitioning to Medicare. You may be wondering, how do I avoid making these costly mistakes? How do I manage these costs? This next section is really focused on avoiding costly penalties and helping you manage your expenses while on Medicare. Ryan, the information you're about to share with our viewers is so important as they plan their personal Medicare timing. So I'll hand it to you to walk us through it.
Thanks, Harold. So let's start by going over the most common Medicare enrollment windows so you can avoid any of those late enrollment penalties. Then we'll turn our attention to some resources available to help you manage your Medicare costs. To help you identify your important dates, let's discuss 3 common enrollment windows: initial enrollment period, special enrollment period, and the annual enrollment period. It's important to note that these are not the only enrollment windows. You could have many more available to you depending on your personal circumstances. However, these are the most common and the ones we're going to spend time on today. The first enrollment period we should review is your initial enrollment period, or your IEP, which is connected to your 65th birthday. It's a 7-month window that includes the 3 months before your birthday month your birthday month, and the 3 months after. It's important to note that if your birthday happens to fall on the first of a given month, your 7-month window starts a little bit earlier. It begins 4 months before your birthday month and ends 2 months after your 65th birthday. If this applies to you, your Medicare coverage will generally start on the first day of the month before your birthday. So if you're turning 65 and don't have access to one of the alternative forms of health coverage Harold highlighted just a moment ago, then you will need to take advantage of your initial enrollment period, both to enroll into Parts A and B, as well as Medicare Advantage or Medicare Supplement and Part D. Next, there are also special enrollment periods that allow individuals who do not enroll into Medicare during their initial enrollment period to select coverage without penalties. Special enrollment periods are often used by individuals who work past the age of 65 and lose access to employer group coverage, for example. There are 2 ways you might take advantage of a special enrollment period. One, to enroll into Medicare Parts A and B, or to enroll into additional coverage. While you can take up to 8 months to enroll into Parts A and B and 2 months to enroll into additional coverage, we'd encourage you to really start taking action as soon as you know that your other coverage is coming to an end. That way, you can be sure that your Medicare Parts A and B and any additional coverage you might be interested in begins as soon as your other coverage ends. So taking action before your current coverage is ending is really key to avoid any costly lapses in coverage. So let's pause for just a moment to explore this common example of when you could use a special enrollment period to enroll into Medicare. If you're currently on an employer group health plan and would like to remain on that coverage past your 65th birthday, you're able to do so without fear of being penalized later as long as your situation meets the requirements. So first, the employer health coverage you're currently on must be based on you or your spouse's active employment. Also, the employer must have 20 or more employees. Some actions you could take if you're considering using this SEP are informing the employer of your intention to remain on group coverage beyond your 65th birthday, confirming that the group plan will fully cover you even if you don't enroll into Medicare Part A and Part B. And then finally, consider asking for confirmation that it is considered creditable coverage. Remember what Harold said, creditable coverage means that the coverage is expected to pay on average the same amount that Medicare would. All right, so let's move on to the third enrollment window and one that applies to everyone already enrolled into Medicare. Once you've enrolled into a Medicare Advantage plan or a Part D plan, you'll have the opportunity to review and switch your coverage every year. This is a really important aspect of your Medicare coverage that we want to make sure that you are aware of. There are several reasons why you might want to consider to review your coverage throughout the years or even switch plans when it makes sense to do so. For example, the design of your current plan might change, or maybe your health needs might change, or you might just be generally dissatisfied with your current coverage and want to explore other options. All in all, the annual enrollment period is a great opportunity to reevaluate your coverage and make sure you're getting the most cost-effective plan that fits your needs and preferences. The AEP timeframe takes place each year from October 15th through December 7th. If you by chance don't make any changes during annual enrollment period and continue to pay any premiums due, your current plan selection will automatically renew on January 1st with the new year's plan benefits and costs. All right, so to quickly recap, the 3 enrollment periods we just reviewed are the initial enrollment period, special enrollment period, and the annual enrollment period. Again, as a reminder, these are not the only enrollment periods that may be open to you. You could also consider visiting Medicare.gov to see all of the times you can sign up for or change a health or drug plan. So now that you know when you can enroll, let's now talk about how you might manage your costs. There are really two primary ways you could explore to help minimize and manage your Medicare costs. One is getting help from a state program that provides financial assistance to certain individuals with limited incomes. The other is to leverage savings, especially a health savings account, to pay for certain qualified medical expenses. State governments administer federally funded programs designed to help lower Medicare coverage costs for retirees who are enrolled in Medicare and meet certain income and asset criteria. You've likely heard of Medicaid, which is a joint federal and state program that helps with medical costs for some people with limited incomes and resources, and offers benefits not normally covered by Medicare, like nursing home care and personal care services. Medicaid can coordinate with Medicare to lower costs for certain eligible individuals. There are also several Medicare savings programs, or MSPs, designed to reduce or cover Medicare-related costs. Generally, MSPs lower your premiums. However, in some cases, these programs can also help pay for deductibles, coinsurance, and copays. Then finally, Extra Help is a federal program that helps pay for some to most of the out-of-pocket costs for Medicare prescription drug coverage. It's also known as the Part D Low Income Subsidy, or LIS. There are two types of Extra Help that can lower your Part D copays, deductibles, and premiums, sometimes even down to $0. Keep in mind, each program has its own specific requirements and eligibility guidelines, and as with most cost savings programs, some conditions do apply. Your state Medicaid office or state health insurance assistance program, also known as SHIP, are great places to turn for any additional help and guidance. And finally, I'd like to take a few moments to talk about HSAs. So if you've been on a high deductible health plan and making contributions to a health savings account, or HSA, great news. You can use this account to pay for certain qualifying health expenses like Medicare premiums, deductibles, and copays, with the exception of Medicare Supplement plan premiums, which cannot be funded through an HSA, long-term care insurance premiums, or vision, dental, and other qualifying expenses. So as you can see, the contributions you're able to make to an HSA could really help with Medicare expenses. But that said, it's important to note that HSA contribution rules can get a little bit tricky for individuals who work past the age of 65 as they approach their Medicare enrollment. So if you're the owner of an HSA account, you'll want to be sure to stop your HSA contributions before you begin the Medicare enrollment process. If HSA contributions are made while you're enrolled into any part of Medicare, you could face some tax implications. So please reach out to your financial advisor or a tax accountant for further help on how to avoid any unnecessary tax penalties there. With that, Harold, I'm going to pass it back to you for a recap of all the information we've talked about today, and also to maybe share with our viewers how they can get in touch with us if they would like further assistance.
Thank you, Ryan, and thank you, Julianne. This is fantastic. We've covered a lot of ground here today, no question. So let's review. First, we discussed the basics of Medicare. Next, we compared the various types of additional Medicare coverage options that can complement your Medicare enrollment. And then we talked about how you can avoid costly Medicare mistakes. So, whether you're approaching Medicare for the very first time or considering a change to your coverage later this year in the annual enrollment period, it's important to remember that you're not in this alone. We understand that navigating this alphabet soup of Medicare coverage can be an overwhelming experience, and Fidelity is here to help. If you're planning to transition to Medicare within the next few months, and would appreciate some assistance, or if you're already on Medicare and would like to review your options, you could consider working with our team here at Fidelity Medicare Services. Our licensed agents can discuss your health needs and preferences and help you enroll in coverage that suits your situation as well as your budget. You'll then be able to work more closely with your financial representative to estimate your healthcare expenses and adjust your retirement plan as necessary. The Fidelity Medicare Services Learning Center has a lot of tools and resources to help you manage your holistic healthcare decisions. Some of you may not yet be 65 and are curious how you're going to bridge the healthcare gap before Medicare. Or some of you may plan to be working after the age of 65 and want to understand what that means for delaying your Medicare enrollment. You'll find helpful tools, articles, and on-demand webinars that you can explore at your own pace anytime that will help answer those questions and many, many more that you may have. If you're already ready to begin your Medicare planning enrollment journey following today's presentation, please visit us at fidelity.com/Medicare, or you can call us at 833-886-0033, TTY 711, to schedule an appointment with one of our licensed insurance agents here on the Fidelity Medicare Services team. All right, so now let's transition to some live Q&A. Ryan and Julianne will help answer some questions that you've all submitted during both the registration process as well as questions we've received throughout the session today. So let's get started. I've got many of the questions right here. All right, let's start with this one. This is a common question. Do I need to enroll into Medicare even if I plan to stay on my or my spouse's group employer insurance plan? Julianne, would you maybe take that one for us?
Absolutely happy to. Thank you, Harold. That's a great question. So it depends. You actually need to find out some additional information. So from your spouse's employer plan or your employer plan, depending on which one you're trying to stay on, you'll need to reach out to your human resources department or your benefits coordinator and ask them if it's considered creditable coverage. Now, just a reminder there, creditable coverage means that the coverage offered is expected to pay on average as much as Medicare would. The other question that's important is if that employer is larger than 20 employees. If so, if both of these things are true, then you can likely stay on that group plan and delay Medicare enrollment. However, if the employer has fewer than 20 employees, you'll likely need to enroll into Medicare to avoid any of those penalties we've talked about today. So double check, find out how it affects your situation, and then you can compare and decide if enrolling into Medicare makes sense or if staying on Medicare or staying on your group employer plan and delaying that enrollment into Medicare is a better fit for you. We'd be happy to guide you through any of that during a meeting if you want to reach out.
Thanks, Julianne. That was excellent. Love it. Ryan, I'm going to direct this one to you because you spoke a little bit earlier about IRMA and IRMA surcharges. And the question that was submitted says, if I'm notified that I will have to pay IRMA surcharges based on my income from 2 years ago, what if my income goes down once I start Medicare? Will my Part B premium change? You referenced this a little, but could you give us a little more info there?
Yeah, absolutely happy to. So it's a great question. I might start by just reminding everybody what those IRMA surcharges are, just really quick. So IRMA is income related monthly adjustment amount. And what happens is when somebody enrolls into Part B for the very first time, Social Security will take a look at your tax return from 2 years ago. And based on your modified adjusted gross income, or MAGI for short, they might, say that you need to pay these additional surcharges on top of base Medicare premiums. So if you do receive that notification from Social Security that you're going to have to pay IRMA surcharges, and you might be thinking, well, my income, might be dropping moving forward. So the good news here is, and sometimes this comes as a pleasant surprise for some folks, is that if your income drops from what it was 2 years ago when they evaluate these IRMA surcharges, and your income drop is in direct relation to a qualifying life-changing event, there is a form that you can submit to Social Security. It's the SSA-44 form. It's called the Life-Changing Event Form. And that's basically just asking Social Security for a redetermination to reevaluate those IRMAA surcharges and possibly reduce them or eliminate them entirely based on what your income will be moving forward. So again, if you want some more information, we're happy to walk you through that.
Thanks, Ryan. I'm seeing several questions in here, and I guess this is timely given we're exactly 2 months away from the Medicare annual enrollment period. And there are several questions related to that event and changing coverage, reviewing coverage. So I'm going to ask a few here. The first is, what are some reasons that I might want to or need to compare and possibly change my Medicare coverage? Julianne?
Yeah, I'd love to take that one. Thanks, Harold. This is a phenomenal question because there are really several factors that might encourage you to reach out and review that coverage. So every September, you will receive something called an annual notice of change, ANOC for short, directly from your carrier. What that ANOC does is outline the changes from the previous year into the upcoming year for your plan. Now, this is for prescription drug plans and for Medicare Advantage plans. So as you review that, you want to make sure that it's the right fit for you still. Some other circumstances, maybe one of your doctors has left the network of your Medicare Advantage plan, or for either one of those, maybe your Medicare prescription drugs have changed. I will tell you that my own parents really actually made a mistake in this space. So when they first started Medicare about 12 years ago, they got onto their original prescription drug plan, didn't realize that that was something that they should be reviewing year after year. As their medications changed, that initial prescription drug plan was not the most cost-effective plan for them. So truly, as your medications change and as your needs and circumstances change, please take the time to review your annual Medicare coverage to make sure that you're on the plan that's the best fit for your needs and preferences.
Yeah, great story. So common with prescription drugs or Medicare Advantage prescription drug plans. Excellent advice. Ryan, I have a couple of quick hitters for you here. I think these are good questions related. I like my current coverage. Hey, is there anything I need to do to make sure I keep it? Do I need to take action to re-enroll or renew my coverage if I'm happy with it?
Great question. First, so happy that you love your current coverage. That's great news. If you do not decide to make any changes to your coverage, as long as you continue to pay any monthly premiums that you have related to your coverage, you don't have to take any action. So that policy will automatically renew starting January 1st. You'll just be kind of grandfathered into the new year's plan benefits and costs moving forward. So yeah, no action if you like it.
Awesome. And related, someone said, can you remind me of those annual enrollment dates and what's the absolute latest deadline for me to change or enroll into a plan this annual enrollment period?
Yeah, great question. So October 15th through December 7th is the annual enrollment period each and every year. The absolute deadline to take advantage of this enrollment period is midnight on December 7th. So try not to, put it off until then, but that is the absolute deadline. Your coverage would take effect January 1st if you do make any changes in that time frame.
Thank you. All right, I've stumbled across one here I really love. Pretty straightforward, but I'm sure on the minds of many of our viewers. I'll throw this out to whichever of you want to take it. Are there any significant changes coming to Medicare in 2025?
Oh, Harold, I'll take that one. That's a phenomenal question. So, Medicare changes year after year all the time, right? The structure might change, the cost change, the plan benefits change. That's just the only constant in Medicare world is definitely change. But there are some significant changes for 2025. So I'm really glad that that question was asked. The Part D prescription drug coverage is a space that has the most notable changes. Many of you may have heard of that coverage gap or the donut hole. You will be delighted to hear that that is going away for 2025. Another huge change is that each Medicare beneficiary's covered medication costs will be capped at $2,000 annually. For people that might have higher medication costs, that could be a pretty significant change in their lives. Now, with that, you've already heard about my parent situation and making sure that you review. It's really important that everyone on Medicare next year that you make sure that the plan that you're on really covers your prescription medications well. So again, happy to help walk you through all of that if that's something that comes up in your situation.
Thank you. Thank you. All right, I think I'm going to try and squeeze in a couple more here. What are the best insurance options if I'm retiring early before age 65 and before I'm eligible for Medicare?
Yeah, I'm happy to take that one. Julianne, feel free to, weigh in with anything else. But I would say that this is a very common question. A lot of people decide to retire before the age of 65, before their Medicare eligibility. So you need a way to kind of bridge that gap until you're eligible for Medicare. So, some options that you could explore would be COBRA. Retiree coverage that may be offered from a prior employer, if they do offer it. Not all employers offer that. Or even looking at plan options from the public marketplace, or maybe even an off exchange plan from a private health insurance company. But all of those options are completely viable. It just really depends on what feels and sits best with your specific needs and preferences. But I will also take this opportunity to maybe plug courses that we have located on our website's Learning Center. Again, you can find that at fidelity.com/Medicare. On our Learning Center page, we have a great article with a lot of different tools and stuff that reference this very thing.
Yes, yes, we've dedicated a whole page with all those resources because this is pretty common. All right, here's one. This is a really I think intuitive one or insightful one here. Can I switch from a Plan G supplemental plan to a Medicare Advantage plan or vice versa? So people understand they can switch, but can they cross plan types each year?
Ooh, I think I'll take that one, Harold, because I get that question from my clients very often. And I think that this might be an educational piece that is really important to go over. So it depends on where you started. Let's go with scenario A. Let's say you start on a Medicare supplement and you want to switch to a Medicare Advantage plan. Pretty easy to do during that annual enrollment period. Make it effective January 1st of the next year. No underwriting attached to that at all. Now, let's say you start on a Medicare Advantage plan and you want to move back to a Medicare supplement. Now, I do need to say before I say this that these rules vary state by state, so it truly depends on where you live. But often, if you want to move from a Medicare Advantage plan to a Medicare supplement, you would likely have to go through medical underwriting. What does that look like? They'll ask you a series of health questions. The Medicare supplement plan will even look at your health records and even look at your medications. So it's not all that easy to get through and not an easy process to go through. They might deny that coverage, which would require you to stay on a Medicare Advantage plan. So just a lot of education pieces around there. Again, very, very specific based off of your area or zip code. So reach out if you want to find out more about your specific situation, but truly it depends.
Makes sense. So yeah, that's good. From Medicare Supplement to Medicare Advantage, a little more straightforward. Advantage to Supplement, a lot of dependencies, where you live and different things about your health. Thank you for that. Last question, and then we'll wrap. I think this is it's one I hear a lot, and it's pretty easy to answer. I've heard that some Medicare plans may not work with all providers. So my question is, can I see any doctor I want when I'm on Medicare? Julianne, you want to finish this off with that one?
Oh, I will, because I'll tell you, I get that question from my clients a lot as well. So it depends. I don't know if you've heard that a lot today, but there's a lot of nuances with Medicare and often why everybody's circumstances is different. So it depends on which plan you selected. Medicare Advantage plans tend to have that network of doctors that you do need to stay within if you want to have that preferred cost share. Whereas Medicare supplements typically allow you to see any doctor that takes Medicare within the US. So you really need to make sure which plan you're on and what your network requirements are. That way you can avoid those extra out-of-pocket costs.
Thank you. Thanks for that. And as we bring our presentation to a close, I'd like to thank you all for your time today. As you can probably tell, we could spend hours talking about this. We have a lot of passion on that topic. And my hope is that after the discussion today, everyone here feels a little bit more confident approaching their Medicare enrollment. I want to give a really special thanks to Julianne and Ryan for partnering with me to deliver this terrific content. Thank you both.
Our
Yeah, happy
pleasure.
to be
Thank
here.
you.
Thank you so much. Have a great rest of your day.